Maintaining a level of skill as a professional is really important because the industry we're in is about delivering healthcare to people. And if we don't refresh our skills, then actually that puts risk in the system. So it's a commitment not only to the patients that we serve, but to the professional individuals who are delivering that care. So the organisation has a responsibility to make sure its workforce are fit for purpose and supported in their skills, and that patients have confidence when we're treating them either in their own home or in hospital, that the people that are treating them have the right skills and are qualified to do that. It's a massive commitment to work patterns. Our staff get really frustrated really quickly about the amount of time we ask them to take out to train. We've worked really hard as an organisation and are still working to streamline training so that it's meaningful for our staff and that they can be released to come to training and that they get something out of the day that they take back to their clinical areas. The promises that we've set are a critical part of the work that we do because we're talking about all of the people, the patients and our staff and the general public. To be able to make a promise to another individual and to be able to hold each other to account is a very strong statement. And actually, the organisation has received these promises and embraced them really well. So I think that this is something that the organisation will be very proud to deliver against, and actually uncomfortable when we don't. Yeah, to be uncomfortable about something means that you feel the pain of discomfort, which allows you to take action to prevent it from happening again. That's really important, that our staff feel that they can take action, which is why our promises to them in allowing them to feel valued and respected, to give them systems and processes and people to be able to deliver their job is so important. It's a vital component. If they don't feel that they're listened to or have the opportunity to make the change, then you get more of the same every time. So I think that this is why the work we've done through the For One and All programme really connects that communication right the way through the organisation, through the patients. Working in a clinical environment is difficult because there is nothing that isn't a priority. But actually through the work we do, looking at our data, listening to our pals, our complaints, i.e. what patients tell us, we know there are some key priorities for us this year. We know the work we do around reducing hospital mortality needs to continue. We've had a difficult year over the last year. We've made some great improvements, but we need to keep going on that journey. We need to keep going on the journey around improving healthcare-acquired infections. We've made some significant improvements over the last 12 months, and we need to keep going with that. In terms of tissue viability, looking after people's skin, we really are committed to eliminating all category 2, 3 and 4 pressure ulcers from the system. These have a monumental effect on individuals. They absolutely impact on their quality of life. And again, finally, we're going to be working to reducing the number of people who fall under our care and particularly eliminating falls that result in a fracture. I think these priorities are absolutely achievable. They are everything that every clinical person certainly understands came into the service to deliver. They are the fundaments of nursing care particularly, and actually they are the things that make people proud when we do well at them. I have absolutely no issue with being inspected. I think it's quite right that we are. And there is no point in fighting in what's going to happen anyway. So we get inspected by everybody, but actually if we do our jobs to the best of our ability every single day, we understand where our issues are and we have plans of action and take action. It doesn't matter who's viewing us. We should be doing that ourselves every day, and I believe we are. So to have the CQC, the Strategic Health Authority, members of our public, it doesn't matter. It's a public service. People have a right to look at us. Well, the Trust Board has committed to our staff to work with them. An evaluation of events like this is part of that. It's really important that people give us true and honest feedback from training events. And today it's really important because we can shape future events when new priorities come along and make it better for people. So that's really important, that people take the time to think carefully, give us the feedback so that we as an organisation can respond to their need. I think being a member of the health service in the current climate is extremely difficult, and I think it's very easy to criticise individuals, whether they're in a clinical environment or an administrative or a management one. But I'd like to take the opportunity to thank everybody for maintaining the service they give, for coming to work every day, and for treating others as they wish to be treated themselves. I think that that would be a great success if the national press and everybody else saw and wrote about that every day. That's the passion that I came into the health service for. That's what I believe I'm leading our professional groups towards, and that's what I believe the professionals are trying to deliver.